Right, so if you have read and understood, let's begin. Get your seat taking station. Kindly begin.
Hello, my name is Dr. Nida. I'm one of the surgical candidates. May I know your name and age, please?
My name is John and I'm 54 years old.
Good.
Nice to meet you, John. I'm here to ask you some questions about your complaint. Can you tell me how can I help you today?
Well, doctor, I've been feeling down a little lately, and I've been feeling difficulty in swallowing food, basically, for the couple of months, and now it's more difficult to take in liquids as well.
I'm so sorry to hear that, Mr. John. Can you tell me more about this complaint?
Well, it's becoming more and more difficult to eat,
Right. So you tell me, it's been there for how long?
It's been there for last 3 or 4 months.
3 or 4 months.
10
I'm so
months.
sorry to hear that. Okay, 10 months.
10 months.
Right. So have you noticed that over the period of 10 months, this difficulty has increased, right?
Yes.
So did you notice that it was there for liquid first or solid first or both?
It was for solid first, now it becomes for liquid as well.
Right. So is there anything that increases this difficulty?
No, it's just there, nothing increases.
Is there anything that relieves this difficulty in swallowing?
No.
Right. Do you have pain while you swallow?
I had difficulty, not the pain.
Right. So I'm gonna ask you a few more questions about to get into the detail of it. Would that be okay with you?
Yes, that is.
Have you ever noticed any weight loss recently?
Yes, I did notice significant weight loss.
And how many kilos have you lost in how many months?
I lost almost 10 kilos in 2 months.
That is too much. So do you have or have you ever noticed any acid taste in your mouth or tummy pain or chest pain because of it?
Because of what? Sorry?
Have you ever noticed any acid taste in your mouth or tummy pain or chest pain because of it?
Yes, I do feel heaviness in my tummy or chest.
Okay. Have you ever noticed any lump in your throat or swelling?
No.
Right. Or have you had any recent mouth ulcers or dryness of your eyes? Any cold hands, unusually cold hands?
No.
Right. So do you have any idea why you are having this problem?
I think my food pipe is becoming narrower.
Right.
Because
so
I feel stuck there.
Okay, right. I understand. So can you tell me what are you most concerned about, and what do you expect from us?
I'm more concerned about not able to eat, and I wanted to know what is happening to me.
Right. So have you ever seen your GP for any medical illness?
No.
Did you ever have any surgeries before?
No.
Right. So are you on any medications, or are you allergic to any medications?
No.
Right. So I'll ask you some personal questions. Would that be okay with you?
Yes.
Right. So what is your occupation and who do you live with?
I work in the office and I live with my wife.
All right. Right. Do you smoke?
Occasionally.
Okay. And do you consume alcohol?
That too occasionally.
Right. So do you ever have shortness of breath, or did you ever get a wheezy chest?
No.
Right. Do you have any joint pain or muscle aches?
No.
Right. And are there any tummy upsets? You get diarrhea or constipation, anything like that?
No.
And how about your water work? Is it fine or is it painful?
It's fine.
Right. So we have almost come to the end of the history, and I've asked you anything. Is there anything else that you wish to tell me or I have missed?
No, not exactly.
Thank you so much, Mr. John.
Thank you.
That's
All
it,
right.
ma'am.
All right. Can you please summarize your history?
I have taken history of 54 years old man, 54 years old gentleman who does not
Yes.
have any comorbids. This patient has a progressive history of dysphagia,
Yes.
initially for solids, then to liquids for 10 months. He also
Yes.
has a significant weight loss of 10 kgs in 2 months. There is, the history is negative for odynophagia, for any dryness of the hand or the mouth ulcers. For autoimmune disorders, the history is not suggestive of esophagitis or achalazias.
So what are
keeping
your
in
differential diagnosis?
my differential diagnosis would be cancer esophagus, achalasia, autoimmune disorder, or esophagitis.
How would you confirm your diagnosis?
I would like to complete my examination for lymphadenopathy. Number one, I would like to have some blood tests for full blood count, urine electrolytes, clotting profile. Apart from that, I would like to have a manometry for confirmation of achalasia and GERD,
Yes.
endoscopy and endoluminal ultrasound to find out if there is for esophagitis and for any tumor growth if there is. And if any workup is suggestive, we can I'll also go for a CT scan.
Okay, that is for the staging of the
Yes,
carcinoma.
staging.
Okay, what are the treatment alternatives that you can offer to this patient?
So keeping on, depending on what stage the patient is, I'll involve the multidisciplinary team, number
Very
one.
good,
Number
yes.
two, I would also go for, if the patient case is operable, we'll go for a esophagectomy with chemo or radiotherapy as
Yes.
an adjuvant. And if it is not operable, we can offer, we can do a palliative chemotherapy or metallic stenting. Other than that, we can also offer feeding jejunostomy to the patient.
Good. Okay. Thank you. Yes.
Thank you so much, ma'am.
As a culture, we'll begin with your helper to give you feedback. Yes.
Right, ma'am.
Before I tell. Yes. What are the? How did you feel, Dr. Faria? Can you give the feedback to Dr. Nida?
Dr. Nida did really well.
All right.
The only thing that I felt that is she may become haphazard, like she asked for the icing before,
yes,
and
in
then
the middle. Yes.
in the middle, and then
Went ahead with the drug history and family history.
family history. She forgot just the family history.
Yes.
And
right.
And what else she missed in the presenting complaint? Because other things I'll discuss later. Many others were listening as well. Yes, who would want to give feedback? Yes. And
hello.
Yes. Yes.
Yes, ma'am.
Is it Dr. Mohammed? Yes, please tell us.
Yes. Thank you, Dr. Rida. Firstly, she has clear voice,
yes.
And also it has positive energy.
Yes.
The thing is, she didn't ask all questions. She
yes.
forgot about some differentiated such as pharyngeal pouch, foul smelling,
Yes.
and also
right.
Yes. Yes.
which
And
pollen gets stuck in throat or
yes.
Yes. And also she forget to ask about neck swelling, goiter,
Yes. Yes.
Mhm.
and history of travel
Yes.
can be due to
Okay.
infected cause.
Okay. Okay.
Yes.
Very good. Yes.
Did you ask about differential about autonomic disease, such as weakness in the
Sorry.
arm? Autoimmune disease?
Weakness.
Autoimmune disease.
Autoimmune.
Yes.
I was more
No,
of
she didn't.
in autoimmune, the scleroderma side, where I had asked about the dryness and the mouth ulcers.
Mm.
Okay.
Just that.
Yeah. Bowel changes, any blood in the stool, any, that's from my side. Yes, Dr. Bas.
Right.
Yes.
Yes, thank you very much.
And
A
the
few of
pain.
my contributions
Yes.
have been made.
Yes.
However, I wanted to ask about, I wanted to mention that she made an exclamation when the patient said she has lost about 2 pounds, I think. And
Yeah,
she said,
yeah.
oh, that's
a
enough.
lot, which is
I
wrong.
think, yes. I
Yes.
think you should
Okay.
rather show some empathy at that point in
Yes.
time. So sorry about that.
Yes.
Okay.
All that.
Yes.
Or you
Yes.
could, or if the patient tells you, okay, I've lost this amount of weight. Oh, how did you notice it? Did you measure it on a scale, or
Yes.
your clothes are loose fitting? Just to emphasize how the patient found out how much or
Yes.
significant
Right.
weight, or you
Okay.
can just show some empathy at that point in
Yes.
time.
Empathy,
Then the other
I
Right,
would go
right.
for. It's more to show that you are concerned. So empathy
Right,
is more,
right.
yes. Yes, Dr. Bas.
Yes, ma'am. Then the other contribution I wanted to make is that when they asked about investigation, ma'am said, how would you confirm your diagnosis? So the first investigation, considering your first diagnosis is
Yeah.
esophageal cancer. So
Yep.
the first, exactly. So you want to do an OGD with biopsy.
Right.
Throughout your discussion, you never mentioned biopsy, and the biopsy is quite
Okay.
important. OGD with biopsy
Okay.
for
Yeah.
histology to confirm my diagnosis and also know the histologic subtype. Then from there,
Right.
and then decide to do to stage and then do ancillary investigation. So staging,
Yeah.
you want to do endoluminal ultrasound scan, and then you'd want to do a CT scan. Then
Right.
to ancillary investigations, of course, full blood counts, renal function test, liver function tests, and all that. You can go ahead and do all those. Then,
Right.
then to rule out other diagnoses, then you can say you would maybe do an esophageal manometry to rule out achalasia, and then all that.
Okay.
But they'll be like a bottom down.
Yes, ma'am.
Yes.
Okay. Right.
Good. Thank you. Yes. So bowel changes and pain was from my side, and the rest they
Right,
have
ma'am.
told you very nicely. Good. Thank you.